This is the second one about like what we learn. Okay, so I remember, and I think Dr. Marian is here. Remember when we do this pandemic plans workshop in Jamaica, in Montego Bay, and she explained very nice a presentation like saying like planning is everything. Okay, but we need to plan based, like this with lessons learned as these reports, like looking forward, but taking a bunch of this evidence during the COVID, in specifically this component. It was a lot of documents and a lot of guidelines that were updated and still updated, and living guideline and resources like the health readiness checklist. These resources that are here for you are important because are still valid to assess the leadership, the coordination, the infrastructure of the health services, the lab, not only the lab or reference lab like national influenza centers or other, but the clinical lab as well. All the management of the bodies, the incineration, the PPEs, etc., etc., etc. So all these documents specifically are talking about the lesson learned about this, and of course, there are not specifically for the context that you deal with in the Caribbean, like small population, not too much, reference hospitals or outpatient clinics, and also with a small population. Okay, but it's important to really use it in these centers, and do this planning and this readiness assessment in a daily basis. Okay, and I'm putting the resources because it's important also to train the clinical professionals in the human resources based on this, because if the new pandemic appears in next year, the most common pathogen will be a virus, a respiratory virus origin. And the guideline that is really recommending all the evidence principles to treat these patients independently of the region is the one that you're seeing here, the toolkit for clinical care that was adapted during the COVID and also was used at the beginning for treat the patients and save lives. Includes, of course, early identification, triage, IPC measures, the distribution, bed capacity, organization of healthcare services, oxygen management, etc., etc., etc. And the other two that are very important are the two in the middle, the blue one and the orange, about the antivirals. The antivirals right now are available for specifically influenza and SARS-CoV-2. And when the beginning of pandemic, a new threat for influenza, specifically, for example, starts, we are going to use oseltamivir for sure, a recommendation on baloxavir, because it still have sensitivity. Okay, so these results are for you, are important to look back and then apply this in your plan.